Diabetes, when it affects the children, it becomes a very serious problem. As you know, children with diabetes, they need to take insulin injections, and they need to check the blood glucose every day. So most of these children are 3 to 4 doses of insulin which has to be injected, and they need to check the blood glucose so that they can adjust the dose. It really becomes a problem if the child is very young. Like, imagine a 2 or 3-year-old child having type 1 diabetes and who needs to get insulin injection so many times in a day. And the parents are really devastated. And it is the same case with a 10-year-old child or 12-year-old child who learns to take insulin and needs to take the insulin every day. And the problem increases several fold when diabetes attacks children belonging to poor socioeconomic group. That's why we at Diabetes and Youth Society, which is also called Day Society, has been taking care of some poor children suffering from this type 1 diabetes, which we used to earlier call it as juvenile diabetes, wherein, as I mentioned to you, the children need to take insulin every day, check blood glucose every day, follow certain diet precautions every day, which is always difficult for a small child. And earlier they were not able to, the parents were not able to buy insulin for the children. They were not able to have the glucometers and strips to do the blood glucose. So whenever they come into our fold, we at Day Society are a group of doctors and volunteers and a few nurses led by me. We offer this kind of services which are absolutely free to them. We not only provide them insulin and other disposables, we also monitor their general health, their blood glucose levels, and then advise them about the proper dosage. And so much so that this has been going on from the year 1999. That's over 21 years. And I know of children who have been coming to me right from those days. We have children who are probably 6 or 7 years during the years of 99 or 2000 who are now 25, 26. We are also happy that many of these girls got married, and it's a major issue for, especially for the girls, when they become pregnant. Because whenever they become pregnant, it's risky for the mother as well as to the child. And it's very difficult actually to give birth to a normal healthy baby, especially for these poor children, because sometimes they are not able to check the blood glucose frequently and take care of their general well-being, nutrition and other things. But actually we at Day Society are lucky that we had many of our girls who have delivered normal healthy babies.